So guys, now we are heading into the high yield part of this lecture. Now, if you are a medical student, the clinical features of Lyme disease will be heavily tested, so you need to be really firm on this part of the lecture. It's important to remember that like syphilis, Lyme disease is also classified into 3 stages, namely localized, disseminated, and persistent. Now, the first 2 stages are part of the early infection of Lyme disease, and the third stage is part of the persistent or the chronic part of the disease. Stage 3 usually occurs within 12 months of the infection. Now, what we're going to do is that we're going to talk about each stage separately and in detail. Now, let's talk about stage 1. Stage 1 is basically early localized disease, and it may present with erythema migrans and low-grade fever. This stage usually occurs within 1 to 28 days following the tick bite. Now, erythema migrans is also known as the bullseye rash. And this classic rash is seen in 70% of the patients and may develop between 5 to 7 days following the tick bite. The uniform rash usually occurs at the site of the tick bite, and it may burn, it may itch, or it may even be asymptomatic. Erythema migrans rash, which is found in 70 to 80% of cases, appears at the site of the tick bite as an expanding erythematous skin lesion. And it measures to about 5 cm in diameter, and it may even be larger than that. This lesion may present as a homogeneous erythema or display a targetoid appearance. Now, because of this targetoid appearance, it has been termed as a bullseye rash, and I love to call it as a bullseye rash because it's easier to remember. Now, if left untreated, the rash persists for 2 to 3 weeks. At the same time, flu-like symptoms may be present. The fever is usually low grade and may be associated with myalgias, neck stiffness, and a headache. Visual problems include eye redness, and tearing may also be seen in some patients. About 30% of patients with this rash will have no further progression of symptoms. That's all about stage 1. Now let's move on to stage 2. Now, stage 2 usually develops 3 to 12 weeks after the initial infection. The clinical features of stage 2 may include general malaise, fever, but now the serious part of stage 2, that it can have neurological features such as dizziness, headache. It can also have muscle pain, and most importantly, you may see some cardiac symptoms like chest pain, palpitations, and dyspnea. It's important to note that cranial neuropathy may be seen as well, and it may present as diplopia. Eye pain and keratitis have also been reported. Now, some patients also complain about joint pains, and it's important to remember that the ankle, knee, and wrist joints are often involved. These symptoms may last 12 to 20 weeks, but recurrence is rare. Now, one high yield point to remember is that oftentimes only a single joint is involved, and some people may mistake it for septic arthritis, so you have to be very vigilant about this. Now, coming to the more serious effects seen in stage 2, these include CNS involvement, and you can see patients suffering from encephalopathy, you can see meningitis, and you can also see various cranial nerve neuropathies. Now, Bell's palsy is seen in about 5% of patients. When meningeal symptoms are present, lumbar puncture is warranted to rule out other causes. Encephalopathy presents with deficits in concentration, cognition, there may be memory loss, and even changes in personality. You may also see extreme irritability, and sometimes depression can also be seen. So you can see that in stage 2, mostly CNS is involved, joints may be hit, and you may see cranial nerve defects as well. So you need to know all these so that you can easily diagnose a patient when he's in stage 2. Now, moving on to stage 3, which is basically seen when the disease is far progressed. Now, late Lyme disease may occur many months or years after the initial infection. The typical features include neurological and rheumatological involvement. Many patients may not have a history of a rash. However, these individuals may present with septic meningitis. So you can see that some patients may not have a rash, but they may present with more serious effects. Bell's palsy, arthritis have been reported, and even a rare form of a disease, you can say, which is known as dysesthesias, in which there is an abnormal, unpleasant sensation felt when someone is touched, and this occurs when the peripheral nerves are damaged. Cognitive defects are also common. So you can see that in stage 3 you can find patients suffering from CNS defects. You can see patients suffering from cranial nerve defects as well. You can see them suffering from joint involvement, but the most important feature of late stage Lyme is arthritis, and this mostly affects the knee joint. Now, another important thing to remember is that cardiac involvement may also be present, and it may present as arrhythmias or transient heart block. Conduction abnormalities are not uncommon, but most cases are isolated and they rarely last more than a few days. A good thing is that it rarely does a patient require permanent pacing of the heart done by a cardiologist, so it's not needed. Now, I know that a lot of information has been told to you in this section because a lot of different things are seen in the clinical features of Lyme disease. But to make it easy for you, I have summarized it. So just remember, in the early localized part of the disease, what you need to remember is that you will see, number 1, a bullseye rash, namely erythema migrans rash, and flu-like symptoms. So these are important pointers to remember. Secondly, in early disseminated disease, you'll see cranial nerve neuropathy, CNS disturbances, and cardiac issues like AV blocks. And in late disseminated disease, what you need to remember is that the pathognomonic part of the late stage is Lyme arthritis, and you can also see CNS disturbances as well. Again, I know it's a lot to digest, but do try to remember this because all of this is high yield and will be heavily tested during your exams. So that brings us to an end to our section on the clinical features of Lyme disease, and I would say that stay tuned because we're going to talk about how to manage a patient with Lyme disease, which is also high yield. So keep watching ahead and keep learning.